The World Health Organization's global vaccine sharing scheme delivered its first shots on Wednesday as a race to protect the world's poorest people accelerates. A flight carrying 600,000 doses of AstraZeneca vaccine arrived in Ghana's capital Accra, the WHO and UNICEF said in a joint statement, kick-starting a campaign that Ghanaian health officials said would prioritise frontline health workers and others at high risk of infection. COVAX was launched in June to prevent poorer countries from being pushed to the back of the queue for COVID-19 vaccines. Nevertheless, wealthier nations have since bought up billions of doses and forged ahead with mass immunisation campaigns. COVAX wants to close a politically sensitive gap by delivering 1.8 billion free vaccines to less developed economies, with the aim of inoculating up to 20% of those countries' populations. That's not enough, however, to achieve herd immunity. And on Tuesday, WHO Director General Tedros Adhanom Ghebreyesus urged wealthier nations to share their vaccines, saying that the goal of equitable distribution was in jeopardy.
210 million doses of vaccine have been administered globally, but half of those are in just 2 countries.
According to a Reuters tally, Ghana has suffered more than 80,000 infections and 580 deaths. Africa's reported death toll passed 100,000 last week, a fraction of those on other continents, but rising fast as a second wave of infections overwhelms hospitals. COVAX said this month that it had allocated the first tranche of 330 million doses of vaccines for 145 countries, including several in West Africa.